I hope I don't bore y'all. So today is really a housekeeping day and going over the handbook. I'm going to kind of skim through the handbook a little bit faster than I do with our paramedic students because it's like 30 pages. And yesterday I spent 2 hours in there with them, and I promised Brandon I'd only take like an hour today. So I am going to give you each a copy of the handbook to let you reference. EMT is a little bit different than paramedic, as in you don't have as many clinical opportunities and there's not as many rules for y'all to follow, but we do still have expectations for EMS students as a whole. And so I'm just going to go over those today and then give y'all an opportunity to meet me and meet Sherry. Sherry's your clinical instructor. So y'all are enrolled in 3 EMS courses. So 1501, which is the actual most of the EMT content, 2305, which is operations, and Brandon's teaching both of those and doing the lab component with it. And then you're enrolled in a course 1160, and that's your clinical course. For EMT students, y'all do 48 hours of clinicals, which isn't a lot, but you are also doing clinicals at the same time that we have you'll be going at the same time as 35 paramedic students as well, and y'all are a big group, so scheduling those, we're just going to kind of talk about that. You do them in 12-hour shifts, and I'll get into all of that in a little bit. You won't start those till October-ish, but if you have any questions about any of that, today is the day to ask, and then don't worry about it too much because you've got a few months before we start with clinicals. It's a crazy week, the first week of class, so I'm trying to get everything organized. So I'm Emily Johnson. I am the director of the EMS program. We have paramedic program and then EMT, and then I teach the dual credit EMT. And Brandon taught that for me last year, and I tried really hard to convince him to do it this year, and I couldn't pay him enough money to do it. So I'll be teaching that course. My background is actually in nursing, so I was a nurse first and then became a paramedic, which is kind of backwards. A lot of paramedics then go to nursing school. But I graduated, I grew up in Howell, graduated from Howell, went to Southeastern my first year of college, and they didn't have a nursing program, so I transferred to East Central University and got my bachelor's degree in nursing there. Started at TMC in the emergency department there, worked for 2 years, loved the ER, and I wanted to be a flight nurse because everybody wants to be a flight nurse or a flight medic, right? Do I have some flight medics in here aspiring? Anybody want to fly? Kinda? Yeah, in a helicopter. Anybody want to be a flight medic? Back in the day, that's all we wanted to do. So I decided I was going to go, at the time in Texas, there were rules that you had to be, if you were a nurse and you were going to fly, you had to be an EMT as well, at minimum. And Brookhaven, which is in Dallas, it's part of Dallas College, they had a bridge program that was RN to paramedic. I said, well, I'll go be a paramedic. And so I did a 1-semester program where I became an EMT and a paramedic in 1 semester. And then the next semester, I did my ride-outs. After that, my husband and I decided we wanted to have some babies, and I did not want to be pregnant in a helicopter, so I didn't go that route. I actually got a job as the trauma coordinator and EMS liaison at TMC, and I did that for 3 years. Worked on my master's degree and completed that at UTA in nursing administration, and then I took over as the trauma program manager at TMC, and I ran trauma services for 5 years there before coming here 3 years ago. So this is my 4th year starting here. I came out to teach. I was going to help Brandon be an EMT instructor, and I did that for 2 semesters, and then I ended up as the director of the program. And so here we are. I love EMS. I really liked it coming from nursing. It helped me be a stronger ER nurse because EMS is focused on emergency medicine. That's all it is. And so that was my favorite part about nursing. And so it gave me ability to really hone in those nursing skills. I like advocating for EMS because I think the profession as a whole is not as advanced as nursing. Nursing's been around for a long time. There's a lot of supporting agencies in the country that support nursing, and EMS doesn't always get that same respect. And so I like the ability to be able to help advocate for EMS and help promote that profession, and doing it through education is a great opportunity. So I'm really proud of our program we've had here. We have a lot of new faculty over the last couple years. Brandon is a huge asset to the program. Y'all will not find a better instructor here, I promise. The way he teaches and engages the class is there's no one like it. So take advantage of this. If you're planning on going to paramedic school, he taught the paramedic program for years, and so he has a hard time sometimes reining it in and sticking to the EMT curriculum. But if you go on to paramedic school, this is going to give you such a good base and foundation. It's going to make paramedic school much easier. So today we're going to go through the handbook. This is a group of our EMT students from a couple years ago. They were Brandon's class. I see we've got about 5 students in here that have already completed the paramedic program. So a lot of our EMT students go on to do the paramedic program. At Grayson, we offer a 12-month shift-based program and then a 6-month, it's about 6.5-month accelerated program. So if y'all have any questions about that, come see me or let me know. But y'all will be eligible. We only start our 12-month program in August. So since y'all are a fall class, if you're wanting to take that 12-month program, you're going to have a semester off. And so if you need some guidance on what to do during that semester, if you're planning on waiting to apply for the year-long program, come see me and let me help advise you. If you're planning on going the fire route, that may be a good time to go to fire school. If you're planning on doing your associate's degree, that's a good semester to knock out those 15 credit hours. So come see me if you need some academic guidance. If you're wanting to go to paramedic school in January, we will have an accelerated program that's starting. You have to be an EMT and nationally certified before you can start the paramedic program. So that means when you finish your EMT program, I think the last day is like December 5th, you want to test with your national registry very soon after, like that next week, and I'll have to pass that national registry to start in January. So when you look at what you're going to do after the EMT program, I'm definitely the resource to help y'all navigate that. And don't be afraid to come see me. So our EMS program, our paramedic program, is accredited, and all paramedic programs are required to be accredited, and we are through KHEP, and COA EMSP is the surveying body. Every 5 years, we have to go through a site visit, so they make sure we're doing what we're supposed to be doing and what we tell them we're doing. With COVID, that got pushed back a little bit, and so we're at about the 7-year mark, and we will be getting a site visit this semester, and y'all will be here the day that our site visitors will be on site. So November 11th and 12th, we'll have a big group of people checking out our paramedic program. They will be interviewing the paramedic students. They shouldn't interview y'all, but if they do, we'll give you a heads up. Brandon will not be in class those 2 days because I need him. He's my mentor, and even though he works for me, he's my go-to person, so he'll be with me those couple days, so we'll just put that on your radar. But one of the things that's very important with COA and our EMS program is our EMS mission statement. And this is a statement for mission for our entire program, which includes paramedic, EMT, and even the EMR classes that we offer. And it's to prepare competent entry-level paramedics in the cognitive, psychomotor, and effective learning domains, with or without exit points at AEMT, EMT, or EMR. So y'all are going to have an exit point here at EMT, and our goal is to make you a competent EMT in each of those learning domains. So cognitive, we're going to go through each of these. Cognitive is the knowledge base domain. That's pretty easy. That's coming to class, learning the material. Brandon is going to take care of that. That's not, this is probably the easiest one. As long as you learn the material, you'll have that knowledge domain down. The second part is psychomotor skills. Brandon will also cover that. You're going to have skills labs on Thursdays. So Brandon will tell you more about that. We will bring in external instructors that will come in, and we'll try to run about a 6-to-1 student to instructor ratio. So y'all are a big class. There will be a lot of skills instructors here going through skills each Thursday to just build on what you learn in that didactic part. So what Brandon teaches you through the week, he'll have a set of skills on Thursday that you're going to go through and you will practice. These are some of my dual credit students from a couple years ago. This dual credit student right here and right here, Pottsboro people may recognize him. He's in our accelerated paramedic program right now. So he did dual credit 2 years ago, graduated high school, and is now in our paramedic program. And they have my middle child in a spinal package there. This is right before they dropped sweet little Cole. He was about 4. So you will learn this in lab. One of the things that you do when you are putting that stretcher in the ambulance, there's a little clip where you want to make sure that that stretcher is locked in place. they didn't have poor Cole locked in place. And so when they pulled him out of the ambulance, the stretcher just went all the way out and he fell down. And I don't know if y'all can see, but there's a little lip right here on our ambulance simulator, and that's what caught him. So he didn't go all the way down to the floor. And so this is like 2 years ago, and he still talks about, Mama, you remember when your students dropped me? So this is the kind of stuff we do in lab. Y'all will be packaging each other. If my kids are out of school, sometimes I'll bring them up here so y'all can practice with pediatric patients. My poor children, they may be traumatized someday. But labs are fun days. They're fun because you get to hands-on do these skills that you're going to have to do in clinicals and when you get out into the workforce. And so we'll go over all of those on the lab. Brandon will take you outside. He'll have scenarios outside. His lab is just really fun to be a part of. And then the last domain is affective behavior domain. This is the hardest domain out of any three of them because we're talking about personal attributes and our behavior. And so this is just a rubric on what the expectations are. We're a lot more focused on affective domain and learning domain in our paramedic program, but I want to introduce it to y'all because it goes along with the handbook as I start talking about some of our expectations in the handbook on conduct and the classroom and in the lab and in clinical setting. That all is tied back to our affective domain. So the expectations for professional presence and time management, we expect our EMS students to always be on time, stay till the end of class, hand in assignments on time. Pretty straightforward. Y'all did a great job. I know it's only the second day of school, but great job being here and on time. Brandon only gets you for 3 hours a day. He would keep you for 5 or 6 hours a day, and he could talk the whole time, I promise, and tell you stuff. So he has a limited of time with you, and so you want to take advantage of that. If you're late to class or you leave early, you're going to miss material, and it's your responsibility to make up anything that you miss. Brandon will not be required to go back and spend extra time to get you caught up, so you want to do everything that you can to be here. When I was in college, I had one rule for myself, and it was to go to class. And I didn't care if I was tired, I don't care if I'd been up all night, I always went to class. Some days I didn't learn anything, but I was always there. And just being present is going to be one of the best things you can do to be successful in this program. You may have days that you don't feel like being here, you don't want to come, but if you miss class, it's not setting you up for success. If you're sick, that's a different thing. Don't come and get us all sick because there's a lot of you in one room. So if one of you gets sick and you come to school, we will pass it to each other and you'll all be down. So if you're sick, stay home. Brandon will work with you, but just try to be here as much as you can. And also with attendance, make sure you just communicate, especially when you get to clinicals. We'll talk about communication with attendance on that. But if you're not going to be in class, send Brandon a message. He worries about you. He won't tell you that, but he'll worry about you if you're not here. And he notices. So I notice too, I get in mama bear mode. So if he tells me so-and-so hasn't been here for 2 days, I'm like, well, what's wrong? Let's reach out to him. So just let us know so we don't worry about you. Teamwork, students always work collaboratively with team members and/or student always engages positively with others. EMS is a team sport, so our EMS education is going to be a team sport. Y'all all probably have very different personalities. We probably don't have the same belief system or background, but we all are required to work together. And it's going to be the same way when you get out in the workforce. Y'all don't have to be best friends with each other. It helps if you make some friend groups and y'all get through this program together, but you don't have to be friends, but we have to work together in a team manner and in a professional and positive atmosphere. Responsibility, students demonstrate responsibility in meeting commitments by being punctual, prepared with materials, ideas, questions, submitting assignments, professional materials, you're handing them in advance or on time. For the classroom, you want to be engaged. Brandon is very interactive. I bet he was asking you all questions yesterday. Was he asking you to... Yeah, I see some head. He will. That's how he teaches. And you're going to get a lot from that. You just need to put forth your part and make sure that you're engaging with him. Conduct is professional, puts forth effort. Equipment utilized safely and returned is courteous and polite. Equipment used on lab days, when y'all get done with lab, make sure everything is put back where it came from. If you don't know where it came from, ask the skills instructor. If they don't know, come find us. And we want to just make sure we leave our lab better than it looked when you got there. Utilize your equipment safely. We use some very expensive equipment here, so take care of it. We don't want to damage anything. We want to take this lab experience serious and act as you're treating real patients. It's not a time for horseplay or anything like that, and take it very serious. And then the last one, which is the hardest one, is self-awareness. Student always maintains a high level of self-awareness about the impact of verbal and nonverbal communications. This is the hardest as a faculty and instructors to address with students, because we don't know what we don't know. And sometimes we make verbal and nonverbal communication cues that are not effective. The example I give, when I was in nursing school, my very last semester, we do an internship, and I spent, I think, 6 or 8 weeks with a nurse in the ER, just shadowing him and learning how to be a nurse on my own. Well, one of my evaluations, he told me that I needed to have more therapeutic facial expressions. I'm like, what does that mean? And at the time, it really offended me. I was like, what is he talking about? That's so rude. Well, what he meant is I was a 21-year-old girl that was very sheltered. I wasn't very sheltered, I was pretty sheltered. I lived in my own bubble. I hadn't experienced much of the world. And when you put me in the ER and I had patients coming in with foreign bodies in the rectum, I was a little shocked, and it was all over my face. They'd walk in and I'd be like, what happened? And so he was telling me that I needed to work on that. And so I just didn't know that I was even making those facial expressions. Now if I make a facial expression, I know I'm making it. It's very intentional. But we do things like that can impact our patient care, and we don't even recognize it sometimes. Or we may have a communication style that can be a barrier in the future for gaining employment. So it's our job as faculty and instructors to prepare you after this EMT program. And so we have a responsibility that if we see something that's not going to help you in your future, we'll bring that to your attention. And we do it from a place of good-heartedness, I promise. We don't want to embarrass anybody or criticize. We just want you to be successful here and when you leave the program, okay? Any questions about that? Anybody else make non-therapeutic facial expressions? Just me? Yeah? See, yeah. I have a hard time too letting people talk. That's the thing. I go like this, and I won't let somebody get a word in edgewise, or they'll be telling me a story and I'll say, well, this is what happened to me, and I'm not always the best listener. So having that self-reflection is good. I think it's good personally and to get you through life, but it's really important in this field as well. We're going to stay in the handbook review because we have the handbook printed. We're going to go through this pretty quickly. Immunizations. Do we all know what the immunization requirements are? Yes, maybe. Okay, we're going to go over them. It's fine. Some of you know, I can't remember. You tell me your name. You've emailed me your immunization records. I've looked at them. What's your name?
Leighton.
What is it?
Leighton.
No, there's another one too. Somebody else that sent them to me. Maybe it was you. I'm going to show you all how to upload those today. So we use a third-party site called SurePath, and it's an online depository where you will put all of those immunization records in there. So we will create accounts today. If you have been here before, a student before, I will move your account over to the new cohort, so you don't have to do anything. Once you upload your documents in here, you can access it after the EMT program. So if you go to paramedic school, you will need these immunizations, even if you don't go to Grayson. So you'll have them all in one spot that you can upload it in there. In there, there's a spot to upload your CPR card. You will have CPR as part of your course. Brandon will do BLS for healthcare providers with you, and so you will upload that when you get that card and that course completed. That has to be done before y'all can go to clinicals, and so when Sherry's scheduling your clinicals, she will make sure that your CPR class is before that date. Yes? You can put it in there if you already have BLS for healthcare providers, but it cannot expire this semester. So if it expires in November, just wait and put your one when you get it in this class, okay? Questions about this? I'm going to go through this and walk you through this. We're going to get iPads. We're going to do it together. It's going to be an activity. Sherry, do you have a deadline for them yet?
I was thinking probably the end of the month, unless they're needing to start one of their series.
So August 31st is going to be your deadline for submission for these vaccinations. I'll go over the vaccinations. You're also going to need a physical and a TB skin test, and that's within the last 12 months. So if you had one 6 months ago, you can use that and put it in there. Immunizations, you do not have to have COVID vaccination or a waiver. When we get into SurePath, there will be a spot for COVID. Ignore that. There will also be a thing for a child abuse screening letter. there, ignore that as well. We don't have to submit those. So those are 2 documents you won't upload right now. You also won't have your CPR uploaded by the 31st, so don't worry about that. It's just the vaccination records that we need in there. We use TMC as our hospital clinical site, and so there is a Texas administrative code that requires you to have the vaccinations, but also our clinical site requires us to provide proof of that immunization. So we can't schedule you at clinicals until we have that proof and verification done. You also, for clinicals, have to have a drug screen done, so we will schedule that. And today, when we go through the paperwork, I'm going to have y'all sign a consent to do that drug screen and a background check. If you have any concerns about your drug screen and background check and you want to come talk to me privately, you can. If you use any CBD products that have THC in them, if you test positive for THC, that's a failed drug screen for our part, and we'll have to dismiss you from the program. So we have a little bit of time probably before you start clinicals. There may be a little bit of time before we have our drug screen, so if you need to get your life together, this is your warning, okay? Failed drug screen, we will dismiss you from the program. If you submit a specimen that is not urine, like you put water in the cup, that's also a failed drug screen, and we'll dismiss you from the program. If you take medications and you have a prescription for them, so say you take Adderall and it flags as an amphetamine, they will ask for you, the drug screen company will call you, their physician will, and ask for a copy of your prescription. As long as you have a prescription and you provide that to them, it's not a big deal. They won't even call me and let me know, hey, this was in their system. They only call me if you don't call them back or if you had something illegal in your drug screen, including THC. Questions about that? While I'm talking about usage, let's talk about tobacco. We are not a tobacco-free campus, so there are designated smoking areas that you can go to. One of them is out here in the faculty parking lot, and I don't know if this is designated smoking area right outside this door, but it's where everybody goes. But this courtyard over here is not a designated smoking area, so do not go in that courtyard and smoke or vape. Do not vape in the building at all, and no use of tobacco in here. So no dipping, no pouches, no spit cups. That's my maybe number 1 pet peeve is tobacco use in the building. So I don't think it's professional and it's not conducive to learning, so there's no need for it in here. If I see it, I'll give you a warning. If I see it again, we'll have to write you up. So that's part of that effective domain and following our student conduct. So go to the designated areas, don't use it in the classroom. Good? Also on classroom housekeeping, Brandon may have already talked about this. If y'all bring food in here, that's up to him, whether he lets you eat in here or not. Just make sure you clean up after yourselves. We had some paramedic students that had lots of snacks a couple years ago and got a little mouse. So we don't want any mice roaming around here. So just make sure you clean up anything after yourself. Okay, so almost everybody's back. Y'all are gonna type in the top. You can't search this because you will not be able to pull it up. So if you're trying to go to SurePath later, it won't work. You are gonna go to graysoncollege.sure, and it's surpath.com. And then when you get there, you're gonna see this screen. If you two that are already registered, don't do anything, I'll fix you in a minute. The rest of you are gonna hit register and you're gonna create an account. As you create this account, you need to make sure that you put your personal information in there. So your social security number, we have to have that in there. Your address, because they're gonna pull your background check out of this information as well. It's right here, graysoncollege.surepath.com. So if y'all will work through that and get your account pulled up. And when you get ready, once you get everything and you're logged in, let me know and I'll show you the next step. So once you get logged in there, you will see to the left, there's like a home screen. You'll click that, and that will show you what you need to upload. But remember, we're not gonna do the child abuse screening, and we're not going to do COVID. You're gonna leave those blank, and you won't have CPR right now unless you have CPR that won't expire before December. You can upload the same document multiple times. So if you have just one sheet that has all your vaccination records on there, you'll upload that same thing to each of those requirements. If you have multiple pages, it has to be in one document. So you can't take a picture of one and upload it and then try to do another one. It will only take one document. So you'll have to like scan it on a PDF where it's in one file. If you don't know how to do that, Sherry can scan it for you. What's the thing that the kid told us yesterday? Microsoft Office, there's some product that you can use on your phone that's free that you can scan it and put it all in one document. So if you're having issues, come see Sherry. We'll tell you all where Sherry's office is at. This is all related to clinicals, and Sherry will handle everything that's clinical related. Anything technology related, I'll do my best, but like scanning stuff is probably her go-to. Okay,
Or if you have questions about your shot records, what you might need,
yes,
come see me too.
yes, and don't wait till the last week. Say, oh, this is due tomorrow. Can you look at my shot records? And then she goes, oh, you need a series of vaccines and you can't get them done by October, then you're not going to be able to do clinicals, and then you're not going to be able to complete the course. So if you have any questions about whether you have the required vaccines or not, bring them to Sherry this week to look at. That way you are not waiting until the deadline, because if you can't go to clinical, you can't finish the program and you can't pass the clinical course, and we won't give you an extension if you don't have those vaccines done, okay? So you have enough time that if you need a vaccine, we can get it going, but we need to have it done this week. Yes, sir.
Was that a 2024 fall day EMT?
Fall day EMT. Yep.
Is there like a timeline on how far along you have to have for the shot? Like if you already got it in previous?
No. So if you had, say, MMR, you've had the series as a child, you just have to have it. If you don't have documentation that you had MMR, then you have to have a titer. So titer is where they draw your blood and look to make sure you have, you're immune to those conditions. So if you don't have vaccination status but you have a titer, then you can submit the titer. If you get the titer and it says you don't have immunity, then you're going to have to go get the vaccines. So it's one of those things that you don't want to wait on. Varicella is a good example, and I bet, I'm not trying to single you out, but I bet there's only one person in here that had varicella, maybe two. Yeah. And I'm one of those two, I think. So if you're like me, there wasn't a varicella vaccine when I was a kid. I had varicella. Who knows what varicella is? What was it? Chickenpox. Yeah, chickenpox. So there wasn't a varicella vaccine. It came out in the early 90s. So about 93, 94-ish, that's when we started seeing vaccines for varicella. If you were born before then, like I was, I have immunity. I have natural immunity. So I get a titer done to show that I have immunity. So it's the same concept. If I didn't have immunity, then I'd have to go get a varicella vaccine. Okay? Any questions over that? We learned something today? Varicella is chickenpox? Okay. We are going to quickly go through the student handbook. This is, we're working on getting this uploaded to our website. We always have a copy of the handbook, but we just updated it for this semester. So I think our website still has the 23-24, but I've put in a request to have that updated to the website, so it'll probably be done this week. If you go to the Grayson website on graysoncollege.edu, you go to current, or go to pathways and go to, here, I'll just show you. Let's walk it through. So we're at grayson.edu, programs and majors. So click pathways, health science, that's what all of you are doing. And then we're going to go to emergency medical services website. And then the easiest way to do is do frequently asked questions, and then you'll see current students. So this handbook is right here if you need it. I believe it's also linked in your syllabus as well. And I think Sherry has it in her course in 1160. Yeah. So when you open this, yeah, we haven't updated it yet. So this is last year's. I'm going to go over the new one with y'all today. And I'll explain the changes too. If you pull up that old document, you can see the difference. But there's not many changes. So that mission statement that we talked about, what are the three phases, without y'all looking? What are the three phases of learning that we focus on? Y'all didn't know you were going to test, did you? What's the first part of your learning the brain is going to take care of? Knowledge, yes, which is also called cognitive. What's the next one? That's the last one. That's a good one.
Skills.
Skills, so what are those called? What's the other word for skills? Psychomotor, very good. And then the last one, she said behavior, which also is called You remember? Effective domain. Perfect. So that's the very first part of our handbook is our mission statement to get you prepared at an entry-level EMT in those 3 learning domains. Rights and responsibilities. I've kind of already touched on this, but I'm just going to go over it. As a student, you're investing a great deal of resources into this program. The EMS education faculty and staff will work to create an environment of learning that will optimize your opportunity for success. As an EMS student, much of what you get from this course will depend on what you put into it. The success of a student in the EMS program is ultimately the responsibility of a student. So what you put into it is what you're going to get. If you want to be successful, you're going to have to put the work in. The EMT program is hard, especially if you have no background or medical knowledge. This is a new world, and there's a lot of information. I think you learn more in this program than I learned my first semester of nursing school, probably in the first year of nursing school, because you're learning a little bit about everything, and it is a lot. You're going to have to study. If you've been smart in school before and you've never had to study, the EMT program it's a new ball game. You're going to have to read your book. You're going to have to look at your book. And did y'all get workbooks? Were y'all able to get workbooks? So I added those this year. Those are going to be very helpful in studying. Even if you just go through it, the answers are in the back. Even if you just go through it and answer those questions and compare it as practice, that will help you to reinforce what you learned in the classroom and what you've read in your book. But you're going to have to put the work in there. Your syllabus will outline how all of your grades, your learning objectives are in there, course policies and procedures, and then you have this handbook as well. With these rights, you also have responsibilities. So as an EMS student, you have to abide by all the education policies, and the Grayson College policies is outlined by faculty and staff. You have to conduct yourself in all times in a manner that's conducive to learning. Exhibit professional manner in both attire and conduct. I'll come back to attire in a minute. And follow instructions, prepare for and actively participate in all skills, class skills, clinical opportunities, demonstrate cooperativeness and consideration while interacting with others, including willful participation and teamwork, and you have to demonstrate flexibility as well. So I don't know if y'all are real flexible people. I'm not always the most flexible person because I like pretty type A, I like it my way, have a plan for everything, I want it to stick to my plan. In healthcare, you have to be flexible. In EMS, you absolutely have to be flexible. You are going to go to a call and you're going to expect it to go one way and it's never going to go that way. And you have to be able to adapt and overcome. And so if you don't have that attribute, you will not be successful in EMS. You have to have flexibility. With that, sometimes we prepare you that in your education, and we may change things. If something's not working up here, we readjust and we get flexible. Some days we may have an instructor that had mandatory overtime and was supposed to be here helping you with skills, and now we're short, so we're having to change how we do the skills lab. Those are things that are out of our control, and we do our best to avoid things like that, but sometimes we have to be flexible. So we just ask y'all to be flexible with us, and we try to be flexible as well. Demonstrate ethical behavior, such as accepting responsibility for your actions and academic performance. If you get towards the end of the semester and you haven't done any homework and you haven't taken any quizzes and you haven't read a chapter in your book and you failed all your tests, that's on you, okay? I'm telling you right now, read that book, do that workbook. If you get a study group, if y'all don't have to leave here afternoon, go eat lunch and come back in the afternoon and get a study group and y'all go over what you did that day. Just because you aren't in class doesn't mean you can't be here. We have some different areas in the EMS department that you can sit and study if y'all want to do a study group. You don't have to stay in the EMS department. You can go to the library. You could go to the cafeteria. But you don't have to leave here just because you're not in class. So you have the ability, you get what you put into it, okay? Practice honesty and accountability, including acknowledgement of personal errors, omissions, commissions, and limitations. If there's something you don't know how to do, tell us. Don't go in there and try to fake it till you make it, because in healthcare, somebody will get hurt if you do that. Demonstrate thoroughness and completeness of work, complete all required courses in a satisfactory manner, demonstrate respect for instructors, fellow students, hospital personnel, EMS agencies, and patients, personnel without regard to race, creed, color, gender, national origin, age, religion, weight, sexual orientation, political philosophy, marital status, or disability. I told the paramedic students this yesterday, we're getting into political season. It could get a little dicey up here. We all, and I said this earlier, we all probably have different beliefs, but we all still got to work together. So let this be conducive to learning. Brandon will have good discussions with you and give you different perspectives on things, but Don't get ugly in here, okay? Disability statement. So if you have a disability and you want us, or you need to have specific accommodations, you need to meet with a disability services coordinator this week. So you need to be over there the first week of class. We do allow some accommodations, but there are some that we cannot allow just to the nature of EMS. The ones we do not honor or do not allow, you are not allowed additional time for skills with specific time frames. An example would be like an intubation. If we have a paramedic, you need to intubate in 10 seconds. We can't allow you 5 minutes to intubate somebody because somebody is going to die. If you are unable to do CPR for maybe a physical reason, we had a student one time that had a deformity of the arm and could not physically do CPR. We could not allow that student to continue in the EMS program because that's a functional need of an EMT provider. They have to be able to do CPR. And so if you have something, it's not being discriminative, it's just a requirement of the profession. And so we try our best to work with people and have them adapt, but if it's something that's a functional requirement of the job, you have to be able to do it with a time frame. Students are not allowed unlimited time to complete a written exam. See this a lot of times with our students that have dyslexia. They may need an extended time. We do allow extended times for exams, but we don't allow unlimited time. And when you go to the registry to take your national registry exam, they rarely give accommodations, but the one that they will do is extended time, and you have to submit physician documentation and all of this information to go with it. I've seen it granted. It's a little bit difficult to go over and get it approved, but if that's something you need to get in with the disability office this week so we can get that accommodation filed. And generally Brandon does not say, hey, you have 2 hours to finish this 300 question test. We're all pretty lenient, but if there's something specific that you're worried about, either talk to him or go talk to the disability coordinator this week. And then students are not allowed to have written exams given by our oral reader. So if you're a student that has had exams read to you in the past, we do not do that in the EMS program. National Registry will not allow an oral reader, and in EMS you're going to have to read things. You're going to have to be able to read your protocols. You're going to have to be able to read policies and stuff like that, and so you have to be able to read that without an oral reader. Pregnancy and marital status, just refer to the student handbook for information regarding pregnancy and parenting status. FERPA, anybody know what FERPA is? Anybody know what HIPAA is? So HIPAA is patient privacy. I call FERPA the educational HIPAA. It's similar. So FERPA, we cannot talk to anybody about you or your academic progress or your conduct or your business unless you have a FERPA release signed. So if there's somebody you want me to communicate with about your school or say your mama or your daddy or your spouse, you want them to be able to get information from me or from the business office, somebody's paying your bill and they need to have access to your account, you have to have that FERPA filled out. If you have any questions about this, you can come see me. I have a FERPA release. We usually run into this with sponsored students where like a fire department is sending an employee to go to school here and they want to know how they are behaving and how their grades are because they're paying for them to go to school. And so those students will sign a FERPA release and then we'll have communication with that agency. If somebody calls up here and says, hey, can you tell me how they're doing in school? My instructors are all going to say, no, you have to go to the director because I have access to see who has a FERPA. And then if there's not a FERPA on file, I'm going to say, I'm sorry, I can't discuss this with you. We don't have a release, okay? If you get to a point where you're looking for employment, because this happens sometimes towards the end of the program, and you need a referral, and you need that agency that you've applied for to get in contact with us to say, yes, they've completed their education, or I need to fill a form out, you still have to have that FERPA filed so we can give that information to them. So that's sometimes a thing we run into. So just come see me if you have any questions. We keep student records for 5 years. After that, they disappear. If you need access to that, just make an appointment. We do have a health science admin assistant. Her name is Jennifer Hill. So if I'm not in the office, she's available. She can try to help you, or she can take a message message and I'll follow up. I am in class Monday through Thursday from 1 to 3 in this classroom. Other than that, I'm generally on campus from 8 to 3. And then when I leave here, I have remote office hours as well. So if I'm not here, you can send me a voicemail. So if you call my office, leave a voicemail, it goes to my email and I get it. Or you can send me an email. And I may not be available 24/7, but I promise you I check email and voicemails constantly. So if you need something, reach out to me. You also can contact Brandon through Canvas. I'm not sure if I'm not in your Canvas class yet, but just send me an email if you need something. Grading, that'll be outlined in your course syllabi, what the expectations are. If for some reason you need to drop or withdraw this program, do not just stop showing up. You need to send an email to Brandon saying, I need to drop the EMS courses, and if possible, provide a reason. You do not want to just stop coming, because then you'll get an F on your transcripts, and then the only way to get rid of that F is to retake this course. Things happen sometimes. You may get in here in a week and be like, this class is not for me. I don't know what I signed up for. I need out. That's fine. Things like that happen, but tell us so we can get you dropped and you're not stuck with an F on your transcript. Okay? And if you're having second guesses about EMS, it's okay, that's normal. I went to my first day of clinicals in nursing school and I called my mom crying and said, I can't be a nurse. I went into a room and I met a colostomy named Charlotte. Y'all know what a colostomy is? Yes, so where your colon, an ostomy is an opening, a colostomy is from the colon. You can also have ileostomies where it comes out different areas of the intestine. So Charlotte was the name of the colostomy. I don't remember the patient's name, but I remember she had a name for her colostomy because that's a thing. I'd never seen anything like it in my life, and we take this bag off because we were going to put some kind of medication in there. My only experience with hospitals at this point is I'm 19. I've never been in the hospital for anything, and my mom was a nurse at Baylor Frisco, and if y'all are familiar with Baylor Frisco, it's like super nice, and it's where people go to have elective surgery or have babies. And when you have a baby there, like I did with my youngest, you get a celebration dinner and you eat steak and lobster. How many hospitals have y'all been to that you get steak and lobster at? Not that many. So this is my experience with healthcare. And I end up in Ardmore, Oklahoma at Mercy Hospital, which is a little more rural hospital, and I meet Charlotte. And Charlotte's bag comes off, and I smell the worst thing I've ever smelled my entire life. And my ears start ringing, I start seeing spots, and I'm about to pass out. And I go out into the hallway, and I pass out. I go against the wall, and I'm down. And I wake up, and I'm crying, I can't do this. I call my mom, who's a nurse. I don't know what I was thinking, I can't do this. Well, you fast forward a couple years, and here I am, the charge nurse at a level 3 trauma center, and I'm in here helping with traumas all the time, and it was my jam. So wound care, not my jam. Colostomy is not my favorite thing, but I still could go into healthcare. I could still go on to be a paramedic. So if you get into a situation where you're like, this is not for me, don't just pull the trigger, because it may be, you just may need to go a different route, okay? So don't let it scare you off, because I was this close to quitting. I'm glad I didn't. If you need help, assistance, let us know. And I don't say that just from an academic standpoint. We have a lot of resources at Grayson. So if you're having some financial hardships, let me know. And if you're don't feel comfortable coming to me, go to Brandon. You can always, I hope you feel comfortable to come to me. I got told last semester I was intimidating because I make too much eye contact, but don't let me intimidate you. I promise I'm here to help you. And so we do have some resources that we can send. Personal counseling is a resource that I have students go to frequently. So if, as a student, you have resources. So if you need help getting to those, let me know and I'll help get you to the right path, okay? Communication with instructors, the only form of official communication is written through your Grayson email or through Canvas. So if you tell Brandon something, that's great, but you need to have it, if it's something important or official, send it in writing, because that's what we look at. Personal cell phones, I don't know if any of y'all have anybody's personal cell phone. If you have our numbers, do not use us for school-related things. Call our office or email us. The caveat to that is Sherry. Sherry will give you her personal cell phone when you get to clinical, but do not abuse it, okay? She'll tell you when to call her and when to text her and things like that. She'll go over that, but just please don't use our personal cell phones for school-related stuff. Conflict resolution, we have a policy in here. I'll let you look over this. The big deal is if you have an issue with an instructor, I want you to try to work it out with them and resolve it. If you can't resolve it with them, then you come up the chain of command to me. If we can't get it resolved, we'll go to the dean. If the dean can't get it resolved, we'll go to the vice president of the college. If you have an issue, don't go just straight to the vice president, because she's going to ask, hey, did you go to your director first? Did you go to your instructor? And we should follow that chain of command. If you don't feel comfortable going to the instructor with that, come to me and let's see if we can work through it before we escalate it, okay? Disciplinary action, we have some examples on here on conduct, which may be considered critical offenses. That may be unsafe or unprofessional. And this disciplinary may result in disciplinary action, which could include dismissal from the program. So these are some of the things that are big no-nos. So dishonesty, and this can be any type of dishonesty, but includes some examples are not reporting accurate clinical hours, documenting skills that were not performed by the student. So if you're checking off a bunch of lab skills that you said you did, but you didn't really do it, that's dishonest. And that's also falsification of records, so we'll talk about that too. Any theft from students, employees, patients, clinical sites, anybody. Evidence of substance abuse, under the influence of alcohol during lecture, lab, or clinicals, possession of prohibited weapons, verbal or physical abuse, HIPAA violation, violation of safety guidelines in any learning environment, falsification of patient records or reports. So that examples include documenting patient reports and Platinum Planner for patients that were fabricated, using the same patient for multiple reports in Platinum Planner, documenting and taking credit for skills that were not performed by the student. So documentation, you document what you do. If you didn't document it, it didn't happen. But if it didn't happen, don't document it. When you get into EMS, these are legal medical records, and so we're going to practice that exact same way here. So don't document something that you didn't do and try to take credit for it, because that's not ethical. Commission or omission of patient care that endangers the patient's life. So you didn't do something that you were supposed to do and it risked their life, then that may be something we need to look at and evaluate and see if we need to have you continue on in the program. Practicing outside the national scope of practice. So Brandon's going to go over the national scope of practice, but I'll tell you a couple things that are not in the scope of practice for an EMT. Anybody want to guess the first one? We'll talk about that one. But in this program, you are not allowed to do IVs, correct? Do some EMTs do IVs? Yes, they do, because there is a process that your medical director can sign you off to do IVs, or if you're an advanced EMT, you may have the ability to do that. Our EMT program does not do IVs, so if you're at a clinical site and somebody asks you to do an IV and you do it, and I find out about it, we're going to have a conversation because it's outside of your scope. You won't do any skill in the clinical setting that you have not been checked off on. So if you haven't done it in lab and you haven't practiced it, you will not do it on a real person. What else? Medications. There may be medications that you don't give. EMTs give certain medications. What? Intubation. That's the big one. You're not going to intubate anybody, okay? We're not going to teach you how to intubate anybody. Don't intubate anybody. Y'all know what intubation is? No? Somebody tell me what intubation is. I see some heads. Yes?
Airway.
It's an airway, an advanced airway. So you stick a tube in there. In their trachea, because what else is in the throat? We have the esophagus. But what can you do as an EMT instead of an intubation? Huh? Well, that's ventilating. What do we do for airway?
Oh, the thing that goes in my nose. That's called.
An airway adjunct. So there's two that EMTs can do. So an OPA or an MPA. And I got to rein myself back in because I'm not getting out there. But there's things you can do that's in your scope of practice, so do those. Don't go put an MPA in somebody your first day if you haven't been checked off on that, but you should be checked off in lab before y'all even get to clinicals. So just know what that scope is, stay in it. Don't do any surgical airways, like cutting open necks and putting straws in. We're not teaching you how to do that. Don't go rogue, okay? Insubordination, and some of those behaviors too include arguing with personnel, interrupting faculty during lectures, being disrespectful, failure to comply with requests regarding changes in behavior, dress, grooming, conduct. Grievance policy, if you have the right to file an appeal or file a grievance, so just make sure we go through that chain of command with any of those and follow the college policy. Financial aid. Does anybody not live in Texas in here? I'm sorry. I'm going to tell you I'm sorry in advance. I have a grant for Texas residents that I'm going to have y'all fill out. It's only for Texas residents, I'm so sorry. But it's called the True Grant. So what I will need y'all to do is we're going to do it this week. We probably won't do it today, but I'm going to have you fill out an application, and it's funding for paramedic and EMT students that are in programs that are less than 6 months old, or 6-month time period. So you finish at one semester. We just have some funding that's available for our students. So we're going to fill that out. I want to say it's like $700, close to that. So y'all have all already paid your tuition, so this will be applied to your account, and then you can either get a reimbursement later and they can cut you a check, or you can use that if you go on for paramedic school. Okay, pretty cool, right? I'm sorry, Oklahoma. Are y'all Oklahoma? I'm sorry. There's always one. Good news is that we're working on Oklahoma clinicals, so y'all may be able to do your clinicals in Oklahoma. Readmission, reinstatement. If you are not successful in the EMT program, you do not have to sit out next semester. So say just things don't work out, life happens, you're not successful, and you want to come back to the program again, you can come in January. You just have to apply when that application opens, just like you did this time. We had a lot of applicants to the EMT program. I had about 20 people that I waitlisted. I had enough for another class. So y'all are fortunate to be here, and there's a list of people that wanted to be here. So take advantage of it. But if it doesn't work out, we can try again in January. Student conduct, I just expect y'all to be professional, respectful. Stay off your cell phones. I'm sure y'all talk about clinicals. You cannot take your cell phone in the clinical setting. Stay off of it in here. Stay off your computers unless you're using it for learning. Pay attention. Take advantage of Brandon while you're in here with him. Try to be on time. Watch your language. Cussing is another thing that gets me. We want to be professional, and y'all are a little bit easier sometimes, EMT students are, than paramedic students, because paramedic students, a lot of them are EMTs and work in the firehouse. And if y'all are familiar with fire, sometimes there's just a different environment there. So I have to remind students sometimes that we're in an educational setting, so we have to make sure that we're very professional. We don't cuss, okay? No sexual harassment, no hazing, have academic integrity. While we're talking about academic integrity, you will use a system called Platinum Planner, and we use that for documentation of your skills, your clinicals, and you will use that for testing. It's called EMS testing. If you get banned from Platinum Planner, you will be dismissed from the program and ineligible to return as long as the ban is in place. So when you take your will not be allowed to have your cell phone with you. But if you don't copy and paste anything from Platinum Planner. So you should be in a lockdown browser when you're taking your exams as well. But even if you try to copy a word, you don't know what it means, and you put it into Google, it will automatically flag and shut you out of the system for 1 minute. And then it will send me an email, it'll send Breen an email, Sherry will get an email, and that's your first offense. If you get 3 of those, just copying a word and putting it somewhere else, they will permanently ban you. And if you get banned from the system, we can't test you. And so we have to dismiss you from the program. If you try to go to another program that uses Platinum Planner, you're still banned from that Platinum Planner, so you can't go to that school either. The other thing is you cannot take information from Platinum Planner and put it on the internet. So if you have a question, and there's even practice questions that y'all can go through, I think, on your own. Don't take that question and say, hey, I'm gonna make me some flashcards on Quizlet. You put any of that information onto a third-party website and they will automatically ban you. I had this happen last semester to a student, had to dismiss him from the program because for whatever reason, he put a question from Platinum Planner onto Quizlet, and they found it, immediately.
Even the practice question?
Do not take anything from there. Don't take pictures of it and then type it up, or don't write anything down and put it up there. If it matches, if it's a match, they will find it. Their technology is amazing, and they're doing that to keep the integrity of their EMS questions. But just fair warning, if you get kicked out of Platinum Planner, there's nothing I can do. I can't test you, you can't document skills, and that's what we use for our program, so you won't be able to do EMT or paramedic here. So don't copy and paste. If you're doing practice questions and you don't know a word in there, you can look the word up, but don't copy and paste it. Okay? I hope that's not too scary, but it is a big deal. Brandon will talk about his attendance policy. We'll talk about attendance policy for clinical in a minute. Dress code. Our paramedic students are required to wear their uniform at all times. We don't make EMT students wear uniforms at all times. When you're in the lab, though, you do have, it's whatever Brandon says. So whatever Brandon says your uniform is, you have to wear that. If he tells you you have to wear a uniform every single day during class, you'll wear a uniform every single day. But my policy is, and his policy supersedes mine. Mine is in the classroom, you just make sure that you are covered and you're not wearing anything that's distracting, okay? So make sure we're covered from about here to here and we're good, okay? Nothing that's distracting. When you get into the lab though, you have to have pants on and closed-toed shoes. Okay, and that's just for safety. Brandon may, once we get uniforms in, he may tell you to wear your uniforms on lab days, and that's usually what we tend to do is when we get uniforms in, you wear them on Thursdays. Whatever Brandon says goes. Clinicals, you have a very specific uniform that you have to wear, and we're gonna order for you. So, I'm sorry, I think I call these my oil changing shirts because that's what it looks like. But you'll look really, really sharp when you're wearing these, I promise. So this is your Class A shirt. You will wear this to all clinical opportunities. We'll get sizing and order forms for these today. You'll wear this with black EMS pants that we will get you size for as well, a black belt, black athletic shoes, or black boots. Crocs and Hey Dudes are not athletic shoes, so no those in the hospital. Tennis shoes, black tennis shoes, or black boots. And they don't have to be like solid black. Don't wear, those are kind of dirty. These two are good. Yours are okay. Don't go out and spend a whole lot of money on expensive boots unless you plan on using them in the future, but just make sure you have black shoes on, okay? Don't wear black with like neon colors, anything that's too distracting, but try to use what you have. You'll be fine. When you go to clinical setting though, you always want to take an extra pair of clothes with you in case something happens and you get dirty. Throw an extra pair of shoes in your car. If your extra pair of shoes are white, I don't care. If you get blood on you and or somebody throws up on you, I want you to have clean shoes on. I don't care too much. Don't go buy something extra just so you fit in a policy. Stuff happens. That's part of our flexibility. But when you're in uniform, I want you to have black pants initially and black shoes. Okay? No hats in the hospital. You can wear hats at the field rotations if they're Grayson College hats. Any of y'all that volunteer or work at any agencies, you cannot wear any department issued uniforms while you're at clinicals. So if you volunteer at Preston, you can't wear your Preston hat, you can't wear your Preston jacket. I don't really want you wearing jackets at all, but we do have a policy. Y'all are gonna be doing clinicals in October, November. It may get cold. If you're out in field shift and you need a jacket, it has to be solid black or solid blue with no patches or logos on it. What I would prefer if you're cold natured and you're in the hospital, I would rather you wear something underneath this because I need to be able to clearly identify that you're a Grayson EMS student. So wear a long shirt. You can wear a long sleeve black or white shirt underneath this where we can still see where you're at. Also part of your uniform policy is you have to have your badge on here. If you don't have a student ID, go get one made. Y'all don't go this week. I tried to take my dual credit kids there yesterday and there were like 30 people in line. So wait till next week when it's kind of died down. You have to have your ID and maybe your schedule, I think, to get an ID made. So get that, and once you get cleared to go to clinicals, Sherry's looked at all of your immunizations, they're good, your background check's clean, and your drug screen's clean, then she will give you a little badge like this, but it'll say EMT student. And that's how we know who's cleared to go to clinicals, and then EMT versus paramedic students, because y'all wear the same uniforms. And so faculty and staff at the hospital site can know EMT versus paramedic, it's this. Your badges need to be worn on your collar, not on your waist, okay? Questions over that? Equipment that you need, I'm gonna give you a lab kit, so don't go buy any supplies. It has a blood pressure cuff in there, it has stethoscope, there's a safety vest, so when you're at clinicals, if you're on scene, and this is in your handbook, if you're on scene of an accident or a fire, even if you have fire certifications, you will never put out fires or do any rescue techniques, but if you're outside at a scene like that, you need to have your safety vest on that says student. The agencies typically have reflective vests. If you're at an MVC, they'll have you put it on, it's part of their procedure, but you need to wear ours that says student on there because it's high visibility. So make sure you'll take that bag with you to every clinicals. You'll start once I get those bags out, you'll probably bring them to lab with you because your stethoscope is in there. There may be a pen light in there too. I think a pen light's in there as well. So you shouldn't have to buy anything except for if you don't have black belts and black shoes, okay? I think I've gone through all of that. Grooming and hygiene. So I'm just going to read this so we're all on the same page. Students are expected to maintain personal and oral hygiene to prevent strong body and breath odors. Some students may be required to bathe, brush teeth, or shave more than once per day. Hair must be clean, neatly groomed, and of natural color. Length must not fall below the bottom of the collar while standing. Students with long hair, male and female, are required to wear their hair off the collar in a chignon. I'll talk about that in a minute. Hairstyle must be such that it remains neat and professional throughout the clinical rotation, and one does not draw unnecessary attention. Facial hair must be neatly cleaned, trimmed, groomed, and no longer than a 1/4 inch. However, note facial hair may impair respiratory function, meaning fit test. Perfume, cologne, body spray, and aftershave is not allowed. Makeup, if worn, should be conservative. Nail color and polish must be clear. Artificial nails are prohibited. Shortening of nails may be required for personal safety and infection control. And then the EMS program reserves the right to remove students from classroom, laboratory, or clinical site for poor hygiene. So, especially when you're doing lab days and clinical days, y'all take a shower before you come here. Put on clean socks. Y'all, a lot of times, are going to be doing assessments on each other. So if we need to assess pedal pulses, where's our pedal pulse? Foot. It's in your foot. So we're going to take our socks and shoes off. So just make sure y'all take a shower, especially on lab days. So if there's an issue with grooming, kind of goes back to some of that self-awareness, we'll discreetly bring that to your attention, but just make sure y'all shower. Y'all are going to be doing EKGs on each other and listening to lung sounds. Y'all are going to be each other's partners. So take a shower, put on your deodorant, clean socks, clean shoes before you come, especially on lab days. Hair for clinicals, it needs to be off. So anybody with off your collar, anybody with long hair, a chignon, didn't know what it was till I read this policy for the first time. It's essentially a pretty bun. So don't put it in a messy bun, but just pull your hair up in a bun. And the reason why we do that is, one, you don't want your hair floating around and everything. And two, you don't want somebody to grab a ponytail and yank you down. They can still grab a chignon, but at least it'll be up and out of control, out of the way, and not at risk for somebody grabbing a ponytail. Jewelry, I don't think that was in there. Clinical, you can only wear stud earrings, no other visible piercings. So anybody who has nose, facial piercings, those need to go out for clinicals. If you put a clear thing in there and I can't see it, that's fine. No necklaces, because what can somebody do? Pull you down. This is all safety risk. Earrings, they can pull. Nose rings, they can pull. Rings need to be just a solid band. So if you have rings, just wear a solid band for clinicals. You don't want that ring to come off. One time I was working in the ER, and I think it was actually my earring. I lost a diamond earring, came out, and I was working in the ER. Like, who wears diamond earrings in the ER? Come on. Learned my lesson, and I didn't do that again. But you don't want to be out on scene of an accident and your diamond falls out of your engagement ring or something like that. So just leave it at home. Don't take anything valuable with you. Stud earrings, only jewelry you can wear, or a solid band. Okay? Natural hair color. Pink and purple are not natural. If y'all want to dye your hair, do it at Christmas break, okay? Let's see. Cell phones, I already kind of talked about cell phones. Just be respectful of cell phones, but you cannot take them into the clinical setting. If you emergency, like you're waiting on a phone call, somebody's about to have a baby and you're waiting for the phone call, and you can tell your clinical instructor and they'll let you go in there and check the phone, or you can even have them hold your phone, and then if it rings, they'll bring it to you. But don't want your cell phone out. And this is really to protect you too, because you're not allowed to take pictures of anything or video anything in the ER, and you don't want to be accused of putting something on your personal device in a clinical setting that you didn't do. So if we just take it out of the picture, we don't have to worry about that. Cannot carry, even if you're licensed to carry in clinical or field internship setting, cannot conceal carry in any patient carrier areas. If you get injured or sick, and I'll let y'all read all of this, the college is not responsible. So you're going to be working with people that may have infectious diseases. You want to make sure that you take the appropriate infection control practices, wash your hands, wear the appropriate PPE when you need to. If you get sick, it may happen. It just says that the college is not liable. If you get exposed to something at a clinical site, you need to go through their infection control policy. So like at TNC, if you get stuck by a needle up there, you need to let first you need to let your preceptor know. They will get to the charge nurse. The charge nurse will then go to the house supervisor, and they will go through their whole reporting. They have a whole thing that they do and a protocol, and they will follow that. The same for the EMS agencies. So you will let them know, and then you will let me know, so I can let our infection control officer know and go through our policy, okay? This sometimes happens. The most recent one I had was actually a student was exposed who was in contact with a patient who had meningitis, and the agencies are really good about calling me. So the chief called me and said, hey, you had a student over here, and we had a patient that had meningitis, bacterial meningitis. You need to let them know and go through the protocol. Well, the protocol was to get a shot of penicillin. So I sent that student to the doctor. It was his responsibility to get his penicillin, but we notified him. He went and got his penicillin. He was fine. Nobody got meningitis. Immunizations, if you need to know what they are, but you can see them once you get into SurePath, they're just listed here. So 2 MMR, tetanus within the last 10 years, including Tdap. What's that P? Anybody know what that P stands for? In Tdap? No? Pertussis? Anybody know what pertussis is? Whooping cough. So who can get whooping cough? Babies. So as EMS providers, we have to have Tdap with the pertussis vaccination to protect the babies that we take care of. You can't get Tdap. I don't think they get their first one until they're 12 months old. So this is really important when we send students. We send paramedic students to the NICU. We need somebody to go up there that's vaccinated against pertussis, because we don't want these small babies who can't be vaccinated to not be protected. So throw that on there too. Hepatitis B series, varicella, you will need a flu vaccine. So the flu vaccine is probably not out right now. So I'm asking you to submit your vaccinations by August 31st, and you probably cannot get a seasonal flu vaccine until mid-September. What I need you to do in the interim, unless you have had the flu vaccine this season, I'll want you to fill out a waiver for a flu vaccine. Just because you fill out the waiver doesn't mean you can't go get the flu vaccine, and I would encourage you to, because y'all are gonna be working in the ER and doing your clinical rotations as flu season is starting up. Once you get that flu vaccine, you can upload that into SurePath and replace that waiver. But I have waivers that I'll send with y'all today. You don't have to give them back to me, you just sign them and then upload them into SurePath. It does require a witness. Your neighbor can be your witness to sign that paperwork and just upload it in there. And that way we can get you in compliance with the hospital requirements, and we can get you scheduled to clinicals. And then once that vaccine comes out, you can get it and then re-upload that. That makes sense? We're almost through, I promise. We talked about drug screen, criminal background checks. You do have liability insurance while you're enrolled in the EMT program. You have to have that, and that's part of your student fees that was collected. So I have you covered under liability insurance while you're enrolled in the EMT program. Pre-clinical skills verification, I already talked about this. You have to check off on your skills in the lab setting before you go out and do them in clinical. Okay, attendance policy. Y'all have 48 hours of clinicals, which is not a whole lot. You have to do 24 hours in the ambulance and 24 hours in the ER, and they are 12-hour shifts. So you're going to have 4 days of clinicals for the entire program. That's not a lot. Once you set those days, those are part of your schedule. And we only allow 2 changes in the schedule, and there are criteria of what we allow scheduling changes for. So a work or job change in jobs or work schedule change, and I have to approve that, and I may require documentation from your employer to show me that you've had a job status change. Important family events and schedule medical tests and procedures. Y'all can only go to clinicals on Friday, Saturdays, and Sundays because you're in class Monday through Thursday. Now, Sherry may allow you to do some 6-hour clinicals, so you leave class and you go to the hospital from 1 to 7, and if she allows you to do that, that's fine. However, you get those 48 hours, but she will discuss that further. The big point is, though, you only have to go 4 days, like technically 4 days. So once you schedule those days, don't schedule a doctor's appointment or a birthday party that day, or if you know your mom's birthday is this day, don't schedule a clinical for that day. You will have a couple months, maybe 6 weeks to get these clinicals done, but you're also doing them at the same time as the paramedic students, and so we can't be changing everybody's schedule because we can only allow 5 students in the ER at one specific time. We also have to notify the hospital 2 weeks in advance of when our students are going to be there. So once we set the schedule, it's locked in place, and that's part of your mandatory, you're supposed to be there. If you are going to miss clinicals, let's go down here, absences. If you're going to be absent from a shift for any reason, so you're sick, your cat died, your car won't start, you're not going to make it, you need to let Sherry know in writing before the start of the shift. All clinical shifts in the morning will start at 7 a.m., so EMS students are expected to be on site, ready to go at 6:45 in uniform. So technically it kind of starts at 6:45. So you should let Sherry know in writing before 6:45 that you're not going to be at the clinical. Same thing for tardies. If you're going to be late, she needs to have written notification before 6:45. That goes either to her email, which is in here, or in Canvas. You can send her an email in Canvas. Sherry's also going to talk about how she wants to be communicated. A lot of times she likes to have a text message to you, hey, I'm going to be sick, and let her know sooner than later. If you're up at midnight and you're throwing up, go ahead and send her a message, say, hey, I'm throwing up, I don't think I'm going to make it in the morning. She won't respond to you. She'll have her phone on silent, but when she gets up at 5 a.m., she's going to see that you're sick, and she's going to let the clinical instructor know that you're not going to be there. You're not going to let the clinical instructors know that you're not going to be there. You will communicate that with Sherry, and she will let them know. And you won't tell your classmates that you're going to be there. So if Carson's sick, he's not going to reach out to Luke and say, hey, tell the teacher I'm not going to be there. He's going to let Sherry know directly, okay? And you can also tell your friends you're not going to be there, but you're required to let Sherry know that you're not going to be there. You will be allowed 1 absence during the entire program. You only have 4 days, so this is really more important for paramedics, but just know you can only have 1 absence. If you have more than 1 absence, and you still have to make that shift up because you have to get the hours. If you have more than 1 absence, then we're gonna have disciplinary action, meet with the medical director, and see how we wanna proceed. Tardies are kind of the same way. We expect you to be on time, so we expect you to be there at 6:45 in uniform, ready to go. If you're gonna be late, so there after 6:45, we need written communication to Sherry, I'm going to be late. If you are going to be excessively late, so more than 30 minutes to the clinical site, you're going to have to make up that entire shift. So you need to communicate with Sherry. Clinical times, be there on time, ready to go. Stuff happens. I'm driving to the hospital and I have a flat tire. It will happen. We allow 2 tardies, and 2 tardies equal 1 unexcused absence. If you're there more than 30 minutes late, or you don't notify your instructor, don't notify Sherry that you're going to be late, it's going to be an unexcused absence, and you're going to have to repeat another 12-hour shift. Okay? That makes sense?
Are they all in like this vicinity?
Yes, so all of your hospital clinicals will be done at TMC and the ER, and then you get to choose where you do your 2 field shifts. You will not do 24-hour shifts, you'll do 2 12-hour shifts. As long as we have a clinical agreement with them, then you can go there. So generally our students go to Sherman, Denison, Preston, Whitesboro, Cook County, Bonham, did I say Sherman? Van Alstyne, Whitewright, Salina, we have an agreement with Salina. Is there anywhere else y'all want to go that I didn't mention?
We have one for Anna.
Yes, Anna will take EMT students, yes. Yes, I do with Alan, actually, only for EMT students. I haven't used that in a while, but my dual credit students want to go there, so yes. Any other sites? We're working on Bryan County, Love County, and Marshall County are the ones in Oklahoma that we're working on clinical side. And we're also trying to get into the hospital into Durant as well. But for y'all going to the ER, TMC is a great place to go for you to get that exposure. They're busy, it's crazy there, you see a lot of stuff. At an EMT level, that's where you want to be, in my opinion. Sherry will go over the clinical rotation objectives, your required numbers, patient contacts. Y'all really just have clinical hours that you have to meet. When you get into the paramedic program, they have a certain number of patients they have to see. So during the paramedic program, our students have to, at minimum, assess 60 adult patients during their program. And there's different numbers. Now, Sherry may tell you at each contact, each ER visit, you have to have 4 patient contacts. She'll set a number, but that'll be outlined in your syllabus, and she'll go over that. So you won't just go up there and roam around. You're going to go up there and assess patients and put the minimum in there. The way I do it with my EMT classes is I usually make them do 4 per shift in the ER, and then when they're on the ambulance, I make them do every single call, not to exceed like 4. And then if you don't have any calls, because that happens, sometimes you go to an EMS agency and you don't have any calls in 12 hours, I'll either have them do a mock report where they just do a report off a scenario that I give them. They can make up a patient report to practice, or we will repeat the 12 hours if they want to. A lot of times students want to go back out there for 12 hours and try to take care of a patient. Your clinical documentation must be done in Platinum Planner, which is the thing we use before you leave the clinical site. So if you are at the hospital, the last hour will be dedicated to documentation. So your instructor, y'all will all leave the ER at 6 o'clock. You'll go into the cafeteria and you'll have like a debriefing, and you will take that time to do your documentation. So you will need some type of electronic device to go and do that documentation. If you do not have access to an electronic device and you need one, the library, you can check out a laptop for a semester. It's a first come, first served basis, but they do have a laptop loan program. If you're interested in that, let me know. There's a link on the website. I had some students yesterday that did that. You fill it out, provide the information, go to the library, get your supporting documents, and they let you borrow a laptop. If you're not able to do that, we also have we have iPads. I don't really want them leaving the campus, but if we have to, we can send them with our instructors. So they have an iPad available there for you to do your documentation on. Okay? Questions over that? Talked about HIPAA, talked about expectations. Brandon will go over examination policy. These are the skills that you must do during EMT. Brandon may add some more on there, but they're in here outlined. You will document all of these in Platinum Planner. We already talked about the first 2 today, so we talked about those airway adjuncts. So throughout the program, these are what you will be checked off on and go through. This is what, after you've checked off in the lab, what you can do in the hospital. Questions over that? Capstone. So the capstone is a knowledge-based exit exam to prepare students to take the National Registry. You have to successfully pass the capstone for me to give you course completion and allow you to test for the National Registry. So what that means is you have to complete the EMT program, you have to pass all 3 classes, you have to do all of your clinical hours, and you have to pass that capstone. So say you pass all 3 classes, you do your clinical hours, you get an A in every single, in operations and 1501, but you go to take that capstone and you get a 50. I can't clear you to take the National Registry. So you may be allowed to complete, you may get your Occupational Skills Award from the college that you've completed the courses, but if you don't pass that capstone, I will not clear you to take the National Registry, and you'll have to repeat the EMT program. So that was a hard thing. I really struggled understanding that coming out here to be a faculty. I'm like, I don't get it. You pass your test and you pass your class, but you can't take the registry. And what it is, that capstone is a predictor of how you're going to do on the National Registry. So if you fail that capstone, you're probably going to fail the registry. And now you've just wasted $120 to go take your test. And our pass rates are tanking. And so you have to pass that capstone. Brandon usually allows at least 1 retake, and it's at the very end of the program. So if you're doing the work and you're passing your unit exams and you're understanding the material, you'll be fine with that capstone. But if you're one of those people that are just book smart and you can just coast through the program and you get to the end, you're probably not going to pass that capstone if you haven't truly learned that material. You can't just prepare for your airway exam and then let it all go. You have to be able to build on everything you learn, and more it's going to build up. That way when you get to the end, you know everything you need to know about respiratory and airway and patient assessment and medical emergencies, cardiology, trauma. You have to know all of that and be competent in that for the EMT to pass that registry. Okay, does that make sense? Okay. After you take your national registry, did Brandon talk about this yesterday about your state licensure? You get into that a little bit. So you have to have that national registry before you can go apply for a state license to work. And when you get to that point, we'll help walk you through that. These are the classes you're enrolled in. Those are the paramedic courses. Talks about national registry, scope of practice, and we survived. I took more than an hour, but questions?